Hey, it's Dr. Miller here, answering your questions about rhinoplasty from New York City, and look forward to talking about a subject that I really enjoy trying to convey to patients because it expresses or it describes the limitations of rhinoplasty. And that's, not everybody can get whatever they want. And a lot of people say, oh, that's right, because it wouldn't look good on my face and it wouldn't look natural. Well, I'm not even talking about that. I'm talking about structurally. I'm talking about physically, is it possible for me to put any type of nose on anyone's face? And the answer is no, because there are limitations to what can be done based on certain features that you, the patient, bring to me. And the number one feature that limits what I can do is skin thickness and skin contracture. And I want to convey that to you right now using an example. So imagine a patient has a big nose, and what they want is to make it smaller, right? And that's what I do during surgery. What I'll go ahead and do is I'll take off the covering and then I'll do what I need to do to make a smaller structure. I take a bigger structure and I make it smaller. Now, it all depends upon what type of covering exists over those structures, okay? Because if you started out with very thick skin like this, right? If you started out like that, and I go ahead and I make it smaller like this, you may not necessarily, hold on just a second. So if you have very thick skin and I make the inside smaller like that, as you can see, if it's thick skin, it may not contract down. And I can go ahead and make the inside as small as possible, but that doesn't mean the outside is going to necessarily contract around it. That's the limitation. Now, what if someone had thinner skin? Well, here's thinner skin. And if you got thin skin, then as I make the inside smaller, you're going to be able to see a much smaller nose. So that's the role of thick skin and contraction, but even if you have thin skin, there are limitations to what I can do. And I'm going to give that example with a glove and a finger. And this conveys it, I think, really, really well. So this is, let's say, a large nose that someone wants to make smaller, and I'm going to lift the skin, right? I'm going to make the nose smaller, right? And then I'm going to put the skin back down. And the skin is going to contract and contract. But in some patients, it just doesn't contract enough. And they still have this fullness in the tip. And you would think, oh, well, you just got to make the nose smaller. You got to make the structure smaller. You got to make my finger smaller. Well, if you make my finger any smaller, it's just going to stretch this out even more, and you're going to have more of a floppy area or skin. So that's where sort of the art and the skill and experience when I do rhinoplasty comes into play, because I have to make sure that I don't make the inside of the nose too small, which then leaves the outside skin basically without form and without contour and without definition. So if you come see me, you'll see I've got a ton of these kind of teaching tools, because I really want to be able to have you understand what the procedure is and what the limitation is. I think it's one thing for the doctor to just sort of tell you things. Well, that's fine, but it's really important for you to understand it. It's really important for you to really grasp the concepts as either complicated or simple as they may be, so that you know really what can be achieved with this fascinating and terrific operation. This is Dr. Miller from Rhinoplasty, New York City. Look forward to seeing you in New York.